Assalamualaikum, and my name is Afifah Ilyana, and I am from Bachelor in Nutrition. So today I will do my reflection for overall activities, including my portfolio activities. So from the first question, for week 1, we have a briefing on the coursework for PEC, group segregation, and discuss on what we need to prepare for all activities, including the major project and portfolio. And also we learn about introduction to ethics and values. For the second week, we did a role play in hospital based on cultural values, custom of belief, and social norms. We need to be able to handle of language barrier and religion different with caution and courtesy. For example, we use this one for our role play. To solve this issue, we communicate well with the patient and try to get help from other staff that have same language with the patient, and also try to give best service to the patient. So for the week 4, we also did again a role play, which is about ethic on respecting a patient's autonomy. For topic of patient's privacy and confidentiality, we need to respect a patient's record confidential and ask permission first before expose other person or social media, besides only to among healthcare staff that involved. So for the week 5 is our major project activity, and we did a role play about misunderstanding of patient with HIV. We included several ethic values issues such as not respecting the patient's HIV record that the doctor exposed to patient's friends in social media and cause misunderstand among the friends and mother of patient. Patient get justice from lawyers' help. These are examples of not being careful and not use ethical values. So for portfolio activity, I decided to do talk for both because I want to learn speaking well and share my perspective to another person. Two different topics are ethics in nutrition setting and ethics basic society. I think both are necessary to be shared and understand to practice. So the objectives of this PEC participation are to learn about most ethics values and apply some of ethic values for all the weekly activities and also portfolios. Yes, I think objective is reached, but for me it's quite moderate. For all the activities are really important and useful in order to have better work ethic for any career and as a person. These activities help to get more grasp on how things would happen if we don't apply the ethic values. For example, prolonged meeting with the doctor or treatment of patient due to misunderstanding issue can put more burden, and also risk for being sued because exposing patient's info without consent. For the fourth question, I learned about the cultural norms values by our group, and also other groups were interesting and really important to have good relation with patients from different race, different language, or different religion. Means that we have to respect their autonomy as well. I also learned that we must ask the patient for consent before share the patient info to other healthcare staff that not involved in to social media. So fifth question, I tried to give some suggestion during one of activities, but I end up just follow leader and few members suggestion. I tried to do well on role play. for the role given and understand the acting with other team member. I also have joint practice sessions for major project role play and also some weekly activities. So for the last question, in future, I hope I remember to implement most of ethic values that I able to catch up with into any situation such as relation with people and future career. For example, I would try to understand well of a person issue and give help as I can. I also ask concern before share to social media about other people. Thank you. That's all for me.